anybody make shit that's this fly.
Hi guys, welcome back to the Canadian Queen Toves channel on YouTube. Today I'm going to be sharing an update with you based on my situation. Last week, if you haven't watched the video, please watch it. I shared my COVID-19 story with you all, and I've been getting lots of requests for updates. People asking if I've gotten tested, if I have any symptoms. And guys, it's been a trying time, I must tell you, I must be honest. Especially because here in Canada, unlike in Nigeria and a couple other countries, that once someone gets tested and is confirmed positive for COVID-19, they'll move to an isolation center. Over here, you have to go isolate in your homes, and because I share a home with my housemate that tested positive, it meant that we had to stay in the same house. And that's why it's very essential that if you're living with someone that is on the front lines, that is a healthcare worker, that you practice those tips I mentioned in the previous video. I'm going to be sharing with you an update, taking you along the day I went to get tested, and the symptoms I had, and what the results were, and how I'm coping with life after getting my test result. So please stay tuned and enjoy. Hi everyone, so this is a COVID-19, the only actual COVID-19 assessment center in Ottawa, Ontario, Canada. This is what it looks like. I'm just gonna stand in front of the sign so you can see. I came here to get tested because I've been in close contact with someone that tested positive for COVID-19, unfortunately. So today what I had to do was to wear a mask when I got in here. Gave me sanitizers, and then I filled a couple forms, which they filled. I just answered questions, and afterwards when I met the criteria for the assessment, then I did a throat swab. So they explained to me that there are two ways of testing: the nasal swab or the throat swab, and it's dependent on what they have on ground. And today they had just the throat swabs. That's why I was throat swabbed. So the feedback is that in 24 hours, if I'm positive, they will call me. If I don't get any call in 48 hours, then I'm negative. So guys, I'm hoping to not get a call. But the reality is I've been in close contact with someone who's positive. Like, it's at this point, it's like I'm wishing, but the reality is I'm probably positive. So let's hope and see. But yeah, that's it. So fingers crossed, guys. Okay guys, so that was the day I went to get tested, and the reason why I had to go get tested was because I started coughing a couple nights before. When I got the news about the fact that my housemate was positive for the virus, I got a call from the public health. Actually, I called them and then they called back. They reached out to me to inform me that I had to be under isolation for 14 days. And that even though I had a very high chance of having contracted the virus, I couldn't get tested because I wasn't exhibiting any symptoms as of that time. So I was told that once I start exhibiting any of the three key symptoms, coughing, fever, or shortness of breath, I should immediately go to the assessment center. I shouldn't give them a call. I should just go to the assessment center, give them my name, tell them why I need to be tested, and then I will be tested. And I was told explicitly that if I was positive, I would get a call within 48 hours, but that if I was negative, I wouldn't get a call. I had to go check for my result online and then print it out. So you guys can imagine how much I was praying not to get a call from Ottawa Public Health. I got back home, I had to take an Uber, so it was a very stressful process of having to wear my mask and wear my gloves and tell the Uber guy I had to, wind the window down just to ensure there was some adequate airflow. And I got home and I was praying for my phone not to ring. So imagine my shock when my phone rang that night. Guys, I was freaking out. I was really freaking out. Even though I had made my peace with the fact that if I had contracted the virus, I would survive and I would be fine, it was still, I didn't still want the label, right? That I had COVID-19. I was really hoping that I wouldn't have that title to my name, even though no one cares, right? Like, it's not something to worry about. So long as you're healthy and you're alive, that's the most important thing. But you know how your mind just plays tricks on you. And unlike in lots of other places where once you have the virus, you can go to the hospital and, you know, get some treatment and stuff, unless you have serious extreme symptoms, unless you cannot breathe anymore, or like something serious is happening to you, you're not supposed to go to the hospitals. So you're supposed to only go to the hospital when things are extreme. So I was just, all of that was just running through my mind, that okay, how do I know when things are extreme? Is extreme enough or do I have to be really coughing blood? Like, you know, it was a bit of a struggle for me. But then I got that call and my brain nearly exploded. However, the call wasn't from the public health office. And a couple hours later, I got an email that I had a message online. So I went online and printed out the message. And here it is, guys. I tested negative for COVID-19, and that is just the most amazing news, because I was actually, my body was fighting the virus. I could tell I was weaker than normal. I had a few coughs, not a lot, but it was there, even though it could have been just, you know, weather, because I usually get like spring allergies and coughs and stuff. But I mean, I just knew that my body wasn't at its optimum, so I really was worried about having contracted it. But I'm just really glad to share with you all today that I tested negative. And actually, it didn't say negative, it said not detected. So it might be there, but the testing didn't detect it, and that's good enough for me. But I still make sure to practice all the tips that I shared with you in the last video, because I believe those things were very helpful in helping me not contract the virus. Also, I did all of that steam inhalation stuff I shared with you. I drank lots of garlic, ginger and lemon, a lot of it, hot water with garlic, ginger and lemon, and I strongly believe those things help build my immune system. Another thing that I did that I forgot to mention before was that I also kept things like my toothbrush, my washcloth, my towel in my room. So not in the bathroom that I was sharing, but I kept those things in my room. I also had been taking vitamin C supplement for about 9 weeks now. Once I heard COVID-19 was an issue, the day I went to the grocery store, I bought a bottle of vitamin C and I took it every day for about 7 weeks. Sometimes I would miss a day or two, but I would, you know, up the grams. So normally if I was taking 500 mg a day, I would take 1000 the next day if I missed, you know, one day. I strongly believe that these things really helped in boosting my immune system. So I would like to advise you, if you're watching this video, to take vitamin C supplements, to take lots of garlic, ginger and lemon. These vegetables have lots of bacteria and virus fighting benefits. So I strongly believe that it's important that you know, do all that you can. Sleep well. I know like our sleeping schedule is messed up a bit now, but try to get at least 8 hours of rest. And guys, just hang in there. If you have the virus, if you've tested positive, trust me, it's not something that would kill you if you don't have any underlying issues. I live with someone that has the virus and she looks as healthy as ever. She's always on the phone, she's laughing, she's excited about life, she's eating well. So I can tell you from first-hand experience that it doesn't have to be as, you know, mind-numbing as we hear that it is. Of course, some people have extreme cases and extreme symptoms, but for majority of the people that are walking around, they probably even have the virus and no one knows because no one is testing everyone, right? So just be calm, stay calm, ensure that you do not let the anxiety of getting the virus trap you, and just do your best to prevent it as much as you can. Please watch that video. It's very important, guys. I strongly believe, like I said before, that the things I practiced and the things I did and the support I had helped prevent me from getting the virus. Thank you so much for watching. I'll keep you posted on my COVID story. I'll be monitoring my temperature because even though my test result was not positive, it doesn't mean that I do not have it or I cannot still get it. So I still have to be careful, and that's something I think you all should take note of. Thank you for watching. I'll see you in the next video.